The chair now recognizes the chair of the full committee, Chair Rodgers, for 5 minutes for an opening statement.
Good morning. Thank you, Mr. Chairman. And yes, to my colleagues, 17 bills, good things happening, continuing to happen in the Energy and Commerce Committee. I'm proud of this committee and the work that we're doing, building on the rich bipartisan history to come together on important priorities for the American people. The legislation we are considering today will help lower costs for Americans and provide more health care price transparency, responsibly fund community health centers and diabetes research, prevent harmful cuts to hospitals that serve the most vulnerable patients, train more doctors in our communities, and improve FDA's review of animal drugs used by farmers and pet owners. We're taking action on the American people's priorities to make the healthcare system more affordable and patient-friendly. We all know that healthcare is too expensive, and the system is far too complicated. And well-intentioned government policies have too often provided more benefits to large and well-resourced corporations than they have patients. Take the story of Mike Laus from Maine. Last year, he spent 1 hour in an OR undergoing eye surgery. His bill included 3 separate facility fees, totaling $7,800, and the professional fees totaling $6,200. Why are 3 facility fees necessary for 1 hour of surgery in the OR? I don't know. But I do know that the system must be simpler, more affordable, and work better for patients. That is why we're moving bills today to increase price transparency and competition throughout the healthcare system. I want to thank Ranking Member Pallone for his partnership on our bill, the Transparent Price Act, which builds on the work that's been done by both the Trump and Biden administrations to bring prices to patients. We've had 2 hearings on price transparency and lowering health costs. I know they've spurred additional ideas on how to help patients, and I look forward to taking a first step on that work today and continuing this work moving forward. There's another critical reason this markup is so important. The American people want accountability in our government. Congress cannot meaningfully fulfill its critical oversight and spending roles without examining the reauthorizations of expiring programs through regular order. We have heard from HRSA on the importance of these programs and worked hard to make sure the additional mandatory spending is fully offset. I am proud that we're extending mandatory funding for the Teaching Health Center GME program for 6 years. This will help as they plan and recruit for future residency classes. Extending mandatory funding for the Community Health Center Fund will help ensure health centers in my district and yours have adequate resources to provide much-needed primary care services in the community. Finally, regarding a DUFA, whether or not you know it, almost everyone in the room relies on animal drugs approved by the FDA. Whether you have a pet, drink milk, eat meat, the FDA plays a very important role in making sure the drugs we give animals work and are safe. It is important we get this work done on time and in a bipartisan way. So I'm glad that we're on track to reauthorize this on time by moving Representative Pence's legislation through subcommittee today. I look forward to the discussion as we prepare for full committee markup. The Energy and Commerce Committee continues to plow the hard ground necessary to legislate on some of the most important issues before us as a nation. And I certainly appreciate everyone's support, making sure that we are giving people, providing the care, the health care that people need at a price that they can afford. Thank you, everyone. I yield back.
Thank you. The chair yields back. The chair now recognizes the gentleman from New Jersey,